Hello. I usually start my talk by saying it feels funny to stand up here and say thank you for having me here to talk about a topic no mom wants to be an expert in, and that's postmortem tissue donation. But I am grateful to be here, and I became an expert because of the journey my family walked with my son, Michael. Michael was diagnosed with medulloblastoma at the age of 10 while living his beautiful life as a first place state gymnast, an all around great athlete, insatiable learner, and tremendous Harry Potter fan. He underwent the usual protocol for medulloblastoma and was cancer-free for 1 year, and then he relapsed. Facing the reality of death at such a young age, Michael wondered, what meaning would my life hold when I'm going to die at just such a young age? It was right around that time that Dr. Giselle Scholler, a pediatric oncologist and researcher, took Michael on a tour of her research lab. And he saw the little mouse that had the cancer tumors on it in the little MRI scanner in the lab. And it really stuck with him because Michael always thought he was going to grow up to be a scientist like many of you. And it was shortly after that that Michael came up with what he called his master plan. He was going to donate his body to research so they could use him to find a cure. And that decision, that plan changed everything for Michael in the final months of his life because the angst and the existential question of what meaning will my short life hold had been answered for him. Because as he said, through his donation, no other child would have to suffer through what I did. And that gave him peace and consolation to have that hope. And of course, Michael's comfort with his decision helped our family face his death in a new way. It was a positive first step in our grieving process. But now I was faced with making his final wish, his postmortem donation, a reality. And even though he was treated at premier hospitals in Chicago and Boston, no one knew how to make his request a reality. And so I was in full panic mode, thinking I was going to fail him in this final wish until I met another bereaved mom who was able to put me in touch with two researchers who would gratefully receive Michael's tissue. And that was Dr. Lee in Texas Children's and Dr. Michael Taylor at Hospital for Sick Children. And so Michael's pediatrician took on the task of all the details of making his donation possible. And so Michael's tissue, we hear from Dr. Taylor all the time of updates with publications and research breakthroughs that have been done with Michael's tissue. And that's really important to our family because these updates are like a touch point with our boy. We get to see how he's impacting science, not in the way he would have wanted to as a scientist, but in a very real way nonetheless. And that gives our family hope for today's children, for better treatments for them. The title of this presentation is Tissue Donation, the Final Chapter. And that's because in our work with the Swifty Foundation, we found out that Michael was really onto something when he wrote his final chapter of his life by donating his postmortem tissue. What we discovered, though, was how very few families who lose a child to cancer are given the option to write this chapter. And that's because the decision to donate postmortem tissue isn't something you know about unless somebody tells you about it, right? And therefore, it's imperative that every family's care plan includes the medical team talking to them about and able to make one last informed decision on their child's cancer journey. And that's the decision about whether postmortem tissue donation is right for them. So that's the final chapter for tissue donation from the family perspective. The final chapter for research is to be able to take that tissue, to interrogate it, and to try to answer the question, why are these children dying? When researchers don't have access to postmortem tissue, this final chapter cannot be written. And as a mom who lost her child to this horrendous disease, I think it's a critical chapter. There's a missed opportunity for incredible learning when this tissue is not available to study. And the really sad thing is, these children are dying anyways, and this tissue is there, but for the asking. And in this way, families, clinicians, and investigators can together write this final chapter and change the story for the next child. And to that end, Gift from a Child conducted a survey from January to May of 2021 with the approval of several hospital IRBs and the support of pediatric oncology departments from research hospitals from the US, Canada, and Australia. 108 families filled out the survey, and we published an article last month in the Journal of Clinical Oncology based on the survey results, stating the family's perspective on postmortem donation. I'd like to share a few of the highlights. And that's when a family donates, 79% of the time, it's the family that brings up postmortem donation. Whether a family donates or not, the medical team only brings up postmortem donation 21% of the time, And if a family did not donate, 59% of the time, nobody brought up the subject of postmortem donation. And then of the families from our survey who donated, they were very satisfied with their decision to donate 98% of the time. And the families who did not choose to donate were only very satisfied 20% of the time. Families who donated were likely to recommend postmortem tissue donation to other families 96% of the time. And even families who did not donate postmortem tissue would recommend to other families to donate 64% of the time. Now, my goal here was to show you how postmortem tissue is important to families, and you already know how important it is to research. What I invite the researchers here in the audience today is to go back to their institutions and talk to their family-facing clinicians and tell them how their research would be impacted if they would offer families the opportunity to choose for themselves about postmortem donation. By not asking, families are not given the chance to make an informed decision about something that could potentially be very meaningful in the last chapter of the child's cancer journey. And by not asking, discoveries that could be made by researchers are thwarted by not having access to this precious tissue. Our foundation has worked to help create Gift from a Child because I didn't want other parents who were interested in postmortem donation to have to struggle to make it happen the way I did. I would much rather have spent those final weeks with Michael and my family rather than trying to figure out the problem of how to make his final wish come true. This program can potentially benefit the family losing a child, the researchers in need of tissue, and the doctors whose patients are dying can offer the family an opportunity to perhaps bring about some good from their tragedy, paving the way for better treatments for their future patients. We realize this is a very difficult conversation to have, and so the Swifty Foundation is working on a toolkit for clinicians to help them with the conversation, as well as we're going to conferences to meet with palliative care and social workers and other medical teams to talk to them about how we can help them with the ask-in and facilitating the donations. I'm going to turn this over to one of Gift from a Child's incredible tissue navigators. The tissue navigators are the secret sauce to Gift from a Child's success, and there are a few of them in the room. We've got Melissa from Chicago and Augustine here from Children's National and Chris from Weill Cornell, and they should wave their hands and you can seek them out if you have any questions about our program over the next couple of days. They did great work. And I've got Beth here from CHOP who's going to walk you through how Gift from a Child makes it possible for you to offer postmortem donation to your families and how we facilitate the donations for families and how we have the workflows that overcome the logistical barriers so you can offer this important option to your families. So thank you.
So I'm going to start off by the question that we get asked most often, which is how does Gift from a Child work? How do we make these donations happen? So we depend heavily on our network. Our network not only includes the CVTN institutions, but also Diener services. These are people that have the ability throughout the United States and the qualifications to remove a brain and a spinal cord, not only at a medical institution, but also at another location, such as a funeral home. Also transportation services, not only for the decedent, but we also depend on courier services that are able to transport whole organs as well as frozen samples kept at a specific temperature. Other decedent care services, so these would include funeral homes, coroner offices, medical examiner offices. They also have resources that we can use. External autopsy and processing sites. So these are actually non-CVTN centers that we have used for their autopsy and processing services. Duke University is a great example of one of these hospitals. They have a great facility there that we can use for our donations. And our healthcare teams. So we have identified several people throughout the years that are advocates of postmortem donation, and they have proven to not only be wonderful at making referrals and talking to families, but also as a resource and just there to give advice if we get stuck. So all of these put together are really important for our jobs. We have a very large web of these resources, and that's important because sometimes plans can change at the last minute, and having so many contacts allows us to pivot and make last minute changes if needed with some of these donations. So as Patty mentioned, we depend on institutions to make these referrals to us. We are completely set up and prepared to complete these donations, but we're not going to get anywhere unless we get a referral. We understand that this is a difficult conversation for a clinician to have. So as Patty mentioned, we're developing a toolkit in different languages that clinicians can use to talk to their patients. When that conversation happens is completely up to the clinician. There are certain triggers that usually you would move forward with making a referral to gift from a child. And the major one is when the child is entering either palliative or hospice care. The second one, as Patty mentioned, is that more and more families are bringing up donation. So if a family happens to mention, hey, we were interested in maybe donating to research, that's definitely a trigger to give us a call because we can help guide the family in their decision. So really, anyone can make a referral, but these are the people that we usually hear from the most. So those are neuro-oncologists, nurses, child life, social work, hospice. And actually, families have been finding us online and they've been calling the 1-800 number or reaching out to us through the website to learn more about the program and if the donation choice is right for them. So when a referral is made, we need some really basic information: name, date of birth, diagnosis, best contact for medical team and the medical team. I know I've spent a lot of time going over the referral process. And before I move on to the next slide, which is in regards to coordination, the point I really want to make here is that once a referral is made, the tissue navigator takes over all aspects of the donation. So we will take care of all the details. We just need that initial phone call in order for us to get started. And like Patty mentioned, really one of the aims of the gift from a child is to take the burden of any kind of donation responsibilities and logistics off of the healthcare team and of the family so they can spend those final weeks caring for their child. So who coordinates the donation? Well, Patty pointed out about half of our team, I would say, that's here in this room. So currently there are 6 tissue navigators. We're located across the United States. We're on call 24 hours a day, 7 days a week. That 1-800 number that you see on our website, actually, we take turns getting the phones. So if you were to call that number, you will actually get one of us directly. If you call it right now, you'll get Augustine from CNMC that would take that call. So we companion not only the family throughout the donation, but also all of the logistics. And that includes the consenting process, as well as addressing any special requests the families might have. That could be some families want a picture of the tumor, some want tissue sent to a specific lab. We can help facilitate that. The autopsy itself, where is it going to be? When is it going to be? Who is going to do it? Making sure that that autopsy team knows about our collection protocol, because we're not only recovering tumor tissue, we're recovering non-tumor tissue as well, blood, cerebrospinal fluid, and as well as a small skin biopsy. The processing. So this is really important because not every center that does an autopsy has the capability of processing and freezing tissue according to research protocols. So if we have an autopsy, say at one site, they may not have access to liquid nitrogen or to anything that would assist us in freezing tissue. So in that instance, we would actually enable a courier that the brain and spinal cord would be removed at one institution, and we would have the organs either flown or driven from one location to the other to somewhere that the processing could happen. And we would work with them to make sure that they follow our collection protocol and have it shipped safely back to CBTN. We coordinate all the shipping and transportation and all of those logistics. If we're dealing with a non-CBTN site, our clinical research team, as well as our biospecimen team, will actually meet with the pathology team at that hospital, answer any questions that they have on Zoom, of course, answer any questions that they have, review our collection protocol to make sure that these precious samples are recovered properly and frozen properly to be shipped back to our biorepository. And we're also responsible for getting all of that clinical data that CBTN is so famous for. So those are just kind of like a brief overview of what the tissue navigator does, but we take care of all the details yet once again. I also just want to mention that there is no cost to the family for any of this. We take care of a lot of different things like autopsy costs, transportation costs, so there's no cost to the family. Something else that makes Gift from a Child really unique is our Family Companion Program. So these are a group of volunteers, of parents that have already lost a child to a CNS tumor and have volunteered their time to talk to families that are considering donation or have made the decision to donate, but they're just looking for some more information. And all of this information is very easily found on our website. So how can you help? Please help us spread the word about Gift from a Child, not only at your institutions, but anywhere that you can think of, social media, LinkedIn, conferences. It has a great benefit to families and also to researchers as well. Just remember that every Gift from a Child subject is enrolled in CBTN. So if they're a patient at a CBTN center, you may have a sample from their initial tumor surgery. You may have a sample from a recurrence or progressive event. Then you're going to have an autopsy sample. So you're going to have a window in time, not only or longitudinal window, not only of the samples that were collected, but all that data from the time the child was diagnosed until they passed away. And this is how you can get a hold of us. So if you have any questions, please reach out on our website, or we'll be hanging around today or tomorrow, or come stop by our table. Thank you.